So welcome everybody. I'm glad to see you all up bright and early. And my job is to remind you that of all the medical disciplines, hematology is without doubt the best, the most interesting, and certainly the most fun to be part of. So this presentation will cover, in particular, this organisation, the European Hematology Association, and those various topics will be covered briefly in the next few minutes. I understand you've all got a copy of these slides, so some of them have got quite a bit of text on. Don't worry, you should have that in hard copy, so I will not go through all the details on the slides. So this is the European Hematology Association in very short summary. So it's a non-profit organisation. I think that's an important point to make there. We've been going since 1992. We've got roughly 4,000 members now around Europe, and we span a vast number of countries, over 100 now. And our membership goes beyond Europe. Our base is in Europe, but our membership goes well beyond Europe, as I'll mention in a minute, as do our activities. So our mission statement is actually quite important. I guess with most organisations we spend a lot of time navel-gazing about our mission statements, but that I think is very appropriate because they really go to the heart of what we are. And this really is what we are. We are all about promoting excellence in three very specific areas: patient care, research, and education. And we do that in a whole variety of ways, some of which you're going to flavour for, I think, during the course of this meeting. For example, we have a very comprehensive education program, not only at this meeting, but throughout the whole year. We have, we support the careers of young haematologists, particularly those who want to operate at the interface of research and clinical medicine through a variety of grants and fellowships. We have a scientific journal which comes out every month. We have this annual congress, which, as you will hear in a minute, attracts around, at the moment, well over 10,000 attendees. And in general, we feel that there is a really important role for an organisation like this to lobby on behalf of haematology and our patients at the European level, something that the national haematology societies, I think, struggle to do. So education, this is, as I said, one of the major pillars of what we do. We're one of the largest independent providers of hematological education. We do this in a whole variety of ways, not only at the Congress, but we have a lot of workshops, tutorials, ways in which we can bring the advances in haematology to haematologists and others, not only around Europe, but actually throughout the world. So we have a very active outreach program where we feel we can do the best for patients with blood diseases around the world, not by, in some way, providing care, because we couldn't make a difference in that way, but we can make a difference if we can educate people. It's the old adage, isn't it? If you give a man a fish, you feed his family for a day. If you teach a man to fish, you feed his family for a lifetime. So I think that's the reason we put so much emphasis on education. One very recent example of how we're innovating in this area is we've got a very large e-learning centre. E could be electronic, it could be EHA, but it's an e-learning centre, a large online activity whereby haematologists from around the world can log in and have access to a whole raft of material that is carefully crafted to be of importance for training young haematologists. And actually also maintaining the skills of the not quite so young haematologists. There are a variety of things, I think, that are on your menu for the next few days. So that I think, as Ton has said, there's a second press briefing. There will be daily updates. I think the first of these should have reached you this morning. And there's an educational exhibit that you might want to check out outside here, focusing on a highly topical area, actually. And this is immunotherapy, the ability to manipulate our own immune systems to fight a variety of blood cancers in particular. And just in the last year or two, there have been a large number of high-profile breakthroughs in this area. So it's a very happening area just at the moment. So I think that exhibit will be worth taking a look at. This is it, immuno-oncology, the title, a new pillar in hematological cancer treatment. And as I say, it really is a breaking area in research. And then lastly, I want to finish by saying, I mentioned our three pillars, patient care, and I've spent a fair amount of time on education already. The third pillar is going to be the focus for us, our theme of the year for the next 12 months. And that is going to be the third pillar, that is research. And we want to place that very firmly at the heart of hematology for a whole variety of reasons, but primarily because research is really the engine that drives improvements in patient care. Without research, there will be no new ways of caring for our patients. There will be nothing to educate our hematologists about. So research is crucial, and it's vital we support this in as strong a way as possible.